Okay, so for those of you who don't know me, my name is Tara. I work with the Roya Kabuki program at Boston Children's Hospital. And today I am going to share a little bit with you all about some of the research opportunities that we have for families in the Kabuki syndrome community. So here, I just wanted to share a little bit about my start into the world of Kabuki syndrome. So I first learned about Kabuki in 2017, which is when the Roya Kabuki program was initiated in Boston. So I remember, doing some research, taking a look into, what Kabuki syndrome is, what that means for, when I, joined some of the visits in the clinic with Dr. Bodemer, or was working on getting samples in the lab with Dr. Gusoni. And it wasn't until I still, remember meeting my first patient in the clinic with Dr. Bodemer that I really got a sense for what Kabuki syndrome is. And I know I learned a lot that day. One thing that I have loved about, being able to be a part of this program and this community is I have been learning more and more every single day since then. One thing that we, try and do within the Roya Kabuki program is bring together a lot of those clinical aspects and the research aspects, and really work on that community integration between all of the different programs. I think that when we are able to do that, I think, the positive benefits are really amplified. Within the research program here, there is, a sort of relatively easy process for families to get involved in the research. And the very first way to do that is just connecting with us. There's a lot of, ways that you connect through phone, through email. We get, phone calls and emails fairly often. And usually it's a family just reaching out to say, hi, I have a family member with Kabuki syndrome, and we're not quite sure where to start. So, we get those emails all the time. So sometimes if you're not quite sure what you're looking for or what the program's all about, I definitely encourage you to just reach out and maybe get a little bit more information about either research studies or clinical programs that might be of interest to you. Once you potentially decide that this research is something you're interested in, one of the next steps for participating in a research study would be going through the written and verbal consent process. So it's certainly very important to make sure that families are always aware of what's going on within each particular research study that they are consenting to or participating in. So that's something that, we'll definitely go through and answer any questions that you have in as much detail as needed. And then as you get into this particular study, we have some study surveys that will be completed. There are many options for participating and submitting different samples for analysis in the lab. And then there also are some in-person research options at Boston Children's. When we are, talking about who might be a good candidate for enrolling into this research study, it's really anybody within that Kabuki syndrome community. So the child or adult with Kabuki syndrome and their family members are welcome to participate. We are enrolling families from all over the United States. We do have also a significant number of international families that are involved. So it doesn't matter, where you are located. We can do a lot of the consenting processes, surveys, collecting medical records, and even collecting samples remotely. So your location certainly doesn't, play a part in if you are able to participate or not. When we are talking about, what it sort of entails, it's really fairly simple in terms of the families tasks. Usually all the heavy lifting happens with Dr. Bodemer and Dr. Gusoni here when they do come back into the lab with submitting all of the data. And we are continuously enrolling within this research study here. So our study is a form of a natural history study. So there is no end date in mind. We are able to enroll families at any time. And we are collecting medical records and samples in a continuous manner. So for example, if you submitted some medical records last year, it would also be beneficial to collect some medical records this year as well. So we can really get that good solid picture of everything that's going on in a child or young adult as they grow up with Kabuki syndrome. And really the benefit of enrolling or participating in research studies such as this is obviously everybody in this community wants to learn more, maybe for their specific child or family member who does have Kabuki syndrome, but we're also really hoping to have a greater impact on the community as a whole. And participating in research studies like this really is a great, amazing way to have that great impact on the community at large. And I will share a little bit of information on how you can participate here. So let's see if I can move this. One way that we can do the consenting process is in person during a visit to Boston Children's Hospital. If you are, coming in for either a visit with Dr. Bodemer or a visit with any other clinician within the hospital, we can certainly set up times to, meet with you, go over any of the information. And then another way that we can do this is over the phone or through a Zoom call. If families aren't coming into the hospital, that's always something that we can set up. And just recently, we were able to adapt an electronic version of our consent form, which has made things very easy and very simple for families who are doing things on the computer. Now everything is completely online and electronic there in a HIPAA compliant platform. So that's been really helpful for research enrollments. And then your next step would be, completing some of those study surveys. The surveys are a really simple task that it's a really good way for researchers to be able to get a good look into a particular specialty or domain related to Kabuki syndrome, where, it is so broad, we're able to really dive in and pull out some trends, some interesting data there. And those have been able to, result in some research publications that then go out to every other research team working on Kabuki syndrome as well. So it's a really great, fairly simple task in terms of some of the research studies. And then when it comes to participating by providing samples, I had mentioned earlier, there are a lot of different options. And I think that's a really great thing about this research study is there's usually some type of sample option that is interesting or available for a family to be able to provide. Any of these samples that we are able to collect are all sort of, optional within the research study. So there's never a requirement to provide all of them. We often recommend that families provide things like blood samples and either the skeletal muscle tissue samples and skin tissue samples when there is a previously indicated clinical procedure, that we can just collect things at the same time. We understand that collecting blood samples and things like that, it's not fun, and our kiddos go through a lot of that so much already. So when we can limit it, we certainly would like to do that, and we can always work with you and your clinical team to make that happen. We have some options within the same research study for some in-person research participation. So these are the only two options currently that do require a visit to Boston Children's Hospital to visit with either Dr. Bodemer doing the electronic impedance myography, sort of a muscle impedance measurement, as well as the neuropsychological testing that Dr. Goodlett spoke to. That also requires an in-person brief testing period at Boston Children's Hospital. Those are things that we can also work with you to coordinate around any clinical appointments that might be taking place. And these are also certainly open to participants who are not patients at Boston Children's Hospital. We can still set up the time for you to come in for a research only visit for these options if you would like. In terms of future participation, families are really able to continuously go on and submit medical records. We're always very interested in getting records about primary care visits and those well care visits that would really give us that big picture of what's going on. If there's ever any additional genetic testing that has been done, as well as developmental and IEP reports, those are certainly really helpful for families to share with us. And then we want to hear from you. So I think one of the great things about this research study here is that so much of it has been built on hearing from the families firsthand. So we've been able to add in particular surveys, adding in the neurobehavioral testing and things like that, just as we learn from the patient community of what is helpful. So if you want to reach out at any time to learn more, there's some contact information here. I would love to get in touch with you after this. And then I just wanted to say a quick thank you to everybody. So one thing that I love so much about the Kabuki syndrome community here, and I know I'm a little biased, but I always tell people that the Kabuki syndrome community is really the best community around. And I think it really is because there are so many different families who are participating in research. They are participating in clinical efforts or education and awareness, starting initiatives, having conferences like this. And then there are, sort of the families of researchers and clinicians in different hospitals across the United States and then international as well. And it's really special to see everybody coming together in these big community efforts and things such as this conference today that really make the community so special. And I think it really just goes to show that there's going to be a lot more special things to come for this Kabuki community here. So I just wanted to say thank you to everybody here today. Thank you to all of the lab groups and the researchers that make this all possible.